high time we protect ourselves, protect the patients, and then go ahead with our lives. Because Corona, as we all know, is not leaving us today, it's not leaving us tomorrow.
COVID-19 is here with us. Technology has aided the instant transmission of texts, pictures, and videos to afford every inch of the world the opportunity to be abreast with what is going on. Governments, health workers, security councils, and civil society organizations across the globe have employed various measures to manage the situation. In Ghana, health facilities and most public places have adopted strict screening mechanisms to ensure that the virus spread is reduced to the barest minimum. The Northern Region Eye Health Service project, supported by the Swiss Red Cross, is one project that is leaving no stone unturned in ensuring higher standards of preventive and protective care.
We make sure that anybody at all who comes into the hospital will have to wear a face mask before. The operation is no face mask, no entry. And we have placed the buckets with soap, all at the vantage areas at the entrance of each ward. Everyone who is entering there or coming out wash their hands with soap and water.
The Swiss Red Cross project builds on past experiences to strengthen their work. The project was already run on a strong infection prevention and control protocols.
Swiss Red Cross actually introduced some biosafety mechanisms that we actually practice in the theater as we go through surgeries. But because of COVID, now we've been practicing since then. But because of COVID, we have to intensify most of the things that we do in order to make sure that we don't introduce any infection into anybody's eye and even get to a point of spoiling someone's eye.
With the eye surgeries, mostly we normally invite more. But this time, because of the COVID, we have restricted the number. And then apart from that, we have placed plastic chairs all over, and then we've made sure that distance, the 1 meter distance, is observed properly. We make sure that all of them, the patients who are to undergo surgery, are in face masks. Even on the operation table, they are supposed to be on face masks.
It was, however, important that the protocols were adapted to the prevailing situation that required some extra efforts and investments.
I'm wearing a head gear to cover my head. This is a face shield. I'm wearing my face mask to protect droplets from myself to the patient and also protect the patient from getting to me. And I'm wearing my overall PPE that protects me from all kinds of things. There's also a third one to ensure that we don't contaminate the trolley or also contaminate the patient or ourselves.
We think that the program has been very swift in coming to our aid with these protective equipment that we requested for. For this short period of time that we had to break, we've had accumulation of patients, and the last record I had was 1,067 patients.
In Ghana, COVID-19 is silent and found in communities and not health facilities. Most of the confirmed cases had to be hunted down to their communities, with just a handful of them self-reporting as OPD cases. This makes community work very important, and the Red Cross is on top of this.
This time, because of the COVID, the Red Cross volunteers had to move into the communities to educate our clients who are coming for the surgery on hand washing, and also give them the face mask in the community and tell them what they are expected to do in the hospital when they come, so that when they get in here, they will not do things that they are not supposed to do. So we see that when the patients even came in, we never had any problem with them as compared to those who are coming to the general side, because they have not had that prior education.
The Red Cross has adopted a strategy of merging their eye work with education on COVID and how to observe certain positive practices. At the end of the day, all the Red Cross in Ghana looks for is a protective community and knowledgeable citizens with a positive attitude towards the pandemic.
Our visit to this community
And for that matter, this particular house indicates that this house is now COVID-19 conscious house. All the inhabitants here have been conscientized about COVID-19, and it's through eye care we are able to do this for other members who are in this particular house.
After 19 days of the surgical campaign, we caught up with the surgical team in the field. And here is a report that was captured.
We are on our 550th patient. We had to take information from the American Academy of Ophthalmology that gives us the guidelines as to how we do ophthalmic surgeries during the COVID period. And based on that, and with other recommendations, we requested for the PPEs necessary for this program to be successful from the Swiss Red Cross. And thankfully, they provided them, and we felt much safer to go into this venture. And I think from the beginning up to now, it has been really, really successful. The industry that produces ophthalmic equipment, I think they are all also researching into equipment that will help us in the period of COVID to be able to distance ourselves from the patient and still examine them appropriately. So if these equipment come out as soon as possible, I think it's going to help save and prevent the COVID from spreading. So apart from this program being a blindness reduction exercise, it's also a COVID prevention exercise. We all know that a blind person has to touch somewhere or someone to make his way or her way somewhere. Again, people will have to hold them to give them direction. This goes against the social distancing that we talk about, and it increases the risk of either the blind person getting the disease or the caregiver also getting it. After receiving their sight, they now become independent. They don't need someone to guide them, hold them, and send them somewhere. So the independence here is important in the sense that they can do everything by themselves, and they can further enhance their safety.
At the end of the visit, we had two very important take-home messages. One, coronavirus or COVID-19 is going to be with us for a very long time, so we have to learn to live with it. Secondly, a blindness prevention program is more or less a COVID prevention program. It is now very clear that the ophthalmology fraternity comes up as one of the most important sectors in the fight against the coronavirus disease, and therefore it must continue.